I assume in your work you have run into many ethical issues. Could you take us on a brief overview of what kind of ideas or concepts or pillars you use to try to decide your own opinion and help other people decide their own opinion on certain ethical issues?
Sure, and that's a great question, and it's a really big question. So let me really summarize it down as best I can. The theory that I use is called principlism, and there are really four components to that, and you have to sort of weigh the tensions between those components. And you want me to explain what those components are?
Sure.
The first component is autonomy, and it's the belief that a person of decisional age, in our society it's 18 years old or older, has the right to make the decisions about themselves for things that will affect themselves. And that gives rise to the value of informed consent, so that hospitals, people who are doing treating, are obligated to tell the patient, here are the risks, here are the benefits, here are the side effects of the treatment, here's what might happen if we don't do anything, because it's based on the belief that a person has a right to know. That's autonomy. Another principle is that of beneficence, that is the commitment to do good. So whatever we do, it's for the patient's benefit. It's not for our benefit, it's not for somebody else's benefit, but that we're always focused on what is best for the patient. And in that regard, the patient is always the end and never the means. We're always focused on them first and foremost. The third principle is that of non-malfeasance. And some people have talked about it being the first rule of medicine, which is first do no harm. So whatever we do shouldn't hurt somebody. It shouldn't cause them a setback. We don't experiment on patients to see what happens, because that would put them at risk. It could harm them. So that is non-malfeasance. First do no harm. And then the last principle of principlism is justice. So what's fair? What's right? And that brings into question, who's going to pay for it? Maybe a person says, I want this treatment or that treatment, but is it really fair that one person should get all the resources and maybe another person not get any at all? So justice tries to measure out what the individual needs or preferences are over against the larger obligation to society and to those who pay. So all of those principles, those four, all work together, and they seek to create a balance in the decision-making process.
Thank you.
Does that help?
Yeah, that helps put everything in context about where to think and how to think about certain issues, and what approach to take, and the ideas and concepts behind many decisions.
Sure.